What does the best healthcare really mean? Is it just about the treatment with the highest success rate in a clinical trial, or is it something more? Today, we're going to dive into a really big shift in medicine, one that puts you right at the heart of that very question.
It really all boils down to this. We're always told to trust the data, right? The treatment with the highest success rate has to be the best one. Or does it? What if that's only telling us half the story?
So this is where we really start to rethink what best care is all about. We're moving beyond just looking at the numbers to something that's way more personal and, more collaborative.
And right at the center of this whole new way of thinking is this idea called shared decision-making, or SDM for short. So what in the world is it? At its core, shared decision-making is really all about partnership. It's about getting rid of that old model where, a doctor just tells you what to do. Instead, it's a new approach where clinicians and patients figure things out together. And this visual, it just lays it out so perfectly. Think of it like this. SDM stands on two pillars, and they are equally important. On one side, you've got the clinician's expertise, all the data, the research, the know-how. But on the other side, and this is just as crucial, you've got the patient's values. What you prefer, what your life is like, what your priorities are. Both of these get an equal say. And this is a really important thing to get right. This isn't about the patient suddenly being in charge of everything, or the doctor just throwing their hands up. No way. It's about building a real partnership where everyone's voice is heard and, respected.
Okay, so where does this kind of partnership really matter? Well, it becomes absolutely critical when the stakes are highest, when we're talking about decisions that can change your life forever.
Just think about it. Choosing a cancer treatment, making a call about intensive care, or getting ready for a major surgery, these aren't just little medical choices, are they? They are huge, life-defining moments. So why is it so crucial in these moments? Well, it's because the right answer is just so personal. For one person, fighting for a few more months, no matter the side effects, might be everything. But for someone else, the quality of that time might be what matters most. See, there are always trade-offs, and the emotional weight of that choice is just massive. And this quote right here, it just hits the nail on the head. If you only look at the survival stats, you might completely miss what that person actually wants for their life. All right, so we get what it is and why it's so important. But how does it actually work in a real doctor's office? How do you connect the cold, hard data with someone's deeply personal values? Well, it really comes down to this pretty straightforward three-step process. First, the doctor has to present the evidence in a way that's super clear. Next, the conversation shifts to figuring out what really matters to the patient. And finally, they work together to find the right fit, to align the medical options with those personal values. So let's take that first step. Making things clear is everything. Instead of saying something abstract like there's a 30% risk, a clinician might say something like, imagine there are 10 people just like you in this room. About 3 of them would probably get this side effect. It just clicks, It's so much easier to picture. And then we get to the real heart of it all. Exploring what you value. This is all about changing the kinds of questions that get asked. Instead of a simple yes or no question like, do you want this treatment? It's about asking open-ended questions like, what are you most worried about? Or what does a good outcome look like to you? These questions really get past the medical chart and into what's going on in a person's life. Now, I know what you're thinking. How on earth do you do all this in a super short doctor's appointment? And that's a huge challenge for sure. That's where some of these practical tools can really help. Things like option grids let you compare treatments side by side, and value clarification exercises, they help patients think through their priorities maybe even before the doctor walks in. It just makes the whole conversation so much more focused and efficient. But look, these tools are great, but they're just a starting point. At the end of the day, this whole thing lives or dies on good old-fashioned human communication. We're talking about really listening, showing empathy, and just dropping all that confusing medical jargon. Those are the skills that turn a clinical visit into a real partnership.
And you know what? When this is done right, the impact is huge. And I'm not just talking about for the patient. It's profound for the clinicians, too.
Seriously, the benefits are amazing for everyone. Patients feel way more satisfied and they have less regret about their choices, which, by the way, means they're more likely to actually follow through with the treatment plan. And for doctors, it builds so much trust, leads to fewer arguments, and honestly, it brings a deeper sense of professional fulfillment. It's a total win-win. So in the end, shared decision-making does something pretty amazing. It totally transforms healthcare. It stops being this quick transaction. Here's your problem, here's your prescription. And it becomes a real, meaningful, patient-centered relationship.
Which brings us right back to where we started. What is best care? Well, it's not just about what the evidence says. The best decision is one that's based on evidence, sure, but it's also one that the patient clearly understands and, this is the most important part, it aligns with what they value most for their own life.
So, I'll just leave you with this thought to chew on. When you think about your own health, about your own life, what does truly best care really mean to you?